Gentlemen, let's start by understanding the basics. The prostate is a small gland, about the size of a walnut, that sits just below the bladder. Its main job is producing the fluid that mixes with sperm to create semen. This fluid isn't just extra liquid. It contains nutrients, enzymes, and protective substances that help sperm survive and function. In other words, the prostate is like a specialized factory that plays a key role in reproduction and overall male health. Now, here's what many men don't realize. The prostate doesn't just quietly sit there and do its job. It reacts to the lifestyle choices you make. That includes how often you release fluid through either sex or masturbation. Some men wonder, does it really matter if I stop or slow down? And the answer is yes, it can. When the prostate regularly empties its fluid, it works a bit like flushing out a tank. The contents are renewed, the buildup doesn't stagnate, and the gland stays active. When that release slows down or stops, the fluid can sit there longer, and the gland doesn't get the same type of activity it once did. Some researchers believe this may contribute to congestion inside the gland, which could make it feel heavier, more tender, or more prone to swelling. But let's go even deeper. The prostate is sensitive to hormones, especially testosterone and a byproduct of testosterone called dihydrotestosterone, or DHT. These hormones tell the prostate how much to grow, how active to be, and even how it responds to aging. When men are younger, higher testosterone levels fuel a very active prostate. But as men pass 50, hormone levels shift. Testosterone often declines slowly, while DHT can stay active inside the prostate, sometimes making the gland enlarge over time. This condition is known as benign prostatic hyperplasia, or BPH. Now, why does frequency of release matter in this? Think of it this way. When the prostate empties regularly, it may help reduce some of that internal pressure and maintain better circulation in the gland. This activity also signals to the surrounding pelvic muscles and tissues that the gland is still being used, helping maintain tone and function. When release stops altogether, that activity lessens, and in some men, the gland becomes more stagnant. There's also the question of inflammation. Doctors sometimes see men with something called prostatitis, an irritated, inflamed prostate. While this can come from infections, it can also develop without infection, sometimes linked to congestion or poor drainage. Men who go long periods without release may notice discomfort, urinary changes, or a sense of heaviness. Again, this doesn't happen to every man, but it shows how lifestyle choices, including sexual activity, may influence prostate comfort. Let's add one more important layer: prostate cancer risk. Studies have shown mixed results, but some research suggests that regular ejaculation, around 21 times per month or more in some studies, may lower the long-term risk of prostate cancer. The exact reason isn't fully proven, but the theory is that regular emptying may help the prostate shed potentially harmful substances or reduce the effects of buildup. This doesn't mean every man needs to aim for a specific number, but it does suggest that a completely inactive prostate may not be the healthiest scenario. So if you're over 50 and you stop masturbating completely, what really happens? First, your prostate no longer gets that routine flushing effect. Over weeks and months, this can contribute to congestion and a feeling of pressure. Second, your pelvic muscles and nerves get less stimulation, which may affect circulation in the region. Third, depending on your individual risk factors, the gland may be more prone to irritation or gradual enlargement. But before you worry, let me be clear. Stopping masturbation won't automatically cause disease. The prostate is resilient, and every man's body reacts differently. Some men feel fine with less activity, while others notice changes. What matters most is awareness, understanding that your prostate is an active gland, and like any other part of your body, it benefits from use, circulation, and balance. Another point worth noting, when men release less often, hormones like testosterone and prolactin may shift slightly. Some men report stronger morning erections when they stop for a while others feel more restless or even more tired. These changes are linked to how the prostate and brain hormones interact. Remember, sexual function is not just mechanical, it's tied to your endocrine system, your blood flow, and even your emotional well-being. So to sum up this first section, the prostate produces vital fluid for male health. Regular release helps flush and stimulate the gland. Stopping altogether can lead to congestion, inflammation, or enlargement in some men. Hormones and circulation play a big role in how your prostate responds. Regular activity may even reduce long-term risks for prostate problems. This doesn't mean you must follow a strict schedule. It means being aware that your prostate is an active part of your body, and how you treat it influences how it treats you. Stay with me because in the next section, we'll look at what specifically starts to change inside the prostate when release slows down or stops, and how those changes affect daily life, from urination to sleep to energy levels. This is where things really connect to your overall health and quality of life. And before moving forward, don't forget, if you're finding this helpful, give this video a like, hit subscribe, and share it with a friend. Knowledge like this can make a huge difference, especially for men over 50 who often don't get enough straight talk about their prostate health. Now that we've laid the groundwork about how the prostate works and why regular release matters, let's look closely at what actually happens inside the gland when masturbation or ejaculation becomes rare, especially for men over 50. These changes aren't always dramatic, but over time, they can have real effects on your comfort, urinary habits, and even your overall energy. The first thing to understand is fluid buildup. The prostate continues to make fluid even if you don't release it. This fluid is rich in enzymes and proteins, and when it sits in the gland too long, it can cause what some doctors call congestion. Congestion isn't an infection, but it can feel uncomfortable. Men may notice a sense of heaviness in the pelvis, pressure between the legs, or even mild aching in the lower back. It's the body's way of saying, I'm storing more than I should. Next is inflammation. When fluid sits for too long, the tissue inside the prostate may become irritated. This is sometimes linked to chronic prostatitis, a condition that can cause burning during urination, frequent urges to go, or difficulty emptying the bladder. While not every man who stops releasing will develop prostatitis, the risk goes up if the gland doesn't get stimulation for long periods. Inflammation also makes the gland more sensitive, which can show up as discomfort during sitting or even during bowel movements. Another big change is the effect on urination. The prostate surrounds the urethra, which is the tube that carries urine from the bladder out of the body. When the gland is congested or inflamed, it can press more firmly against the urethra. This narrowing leads to a weaker stream, the need to push harder, or feeling like the bladder didn't fully empty. For many men over 50, these urinary changes are already showing up because of benign prostatic hyperplasia, or BPH. If release stops entirely, the added congestion can make those symptoms more noticeable. Here's another factor: circulation. The prostate, like any gland, relies on fresh blood flow to stay healthy. Regular release helps stimulate circulation, which brings oxygen and nutrients to the gland while flushing out waste products. Without this stimulation, circulation may slow, which can increase the risk of irritation or even calcifications, small, hardened deposits inside the prostate. These calcifications aren't always harmful, but they can contribute to long-term stiffness in the gland and further urinary problems. Now let's connect this to hormonal changes. We know testosterone slowly declines with age. When release slows down, some men experience a rise in prolactin, a hormone that builds after arousal and release. If release is withheld too long, prolactin levels may remain slightly higher, which can dampen sexual desire and lower overall energy. This is why some men who stop masturbating completely report feeling flat, less motivated, or more easily fatigued. The prostate itself is sensitive to these hormonal shifts, so the gland can become sluggish without that balance of testosterone-driven activity. Another key point is how this affects sleep and comfort. Many men with congested prostates notice they wake more often at night to urinate. This happens because the swollen gland irritates the bladder, making it signal full even when it isn't. Over weeks or months, this broken sleep cycle can drain energy during the day. Imagine being tired, having to go to the bathroom multiple times at night, and then feeling heavy or achy in the pelvis during the day. It's a clear example of how prostate health links directly to quality of life. Some men also notice changes in erections and sexual function. A congested prostate can make it harder to get or maintain an erection, partly because circulation in the pelvic area isn't as strong. It may also reduce the force of ejaculation when it does happen. Over time, this can affect confidence, which in turn influences overall well-being. Remember, sexual health isn't only about intimacy, it's about how connected you feel to your own body. Now, here's the important takeaway. Stopping masturbation or release won't immediately cause harm. You won't suddenly develop prostate problems overnight, but over months and years, the combination of fluid buildup, inflammation, reduced circulation, and hormonal shifts can make the gland less comfortable and more prone to enlargement. For men already dealing with BPH or mild urinary issues, this can speed up the symptoms. To put it simply, your prostate is like a working machine. If you stop running the machine, it doesn't break down instantly, but parts may stiffen, fluids may thicken, and the system may not run as smoothly when you try to use it again. At this stage, some of you might be thinking, so does this mean I have to keep masturbating regularly to stay healthy? The answer isn't that simple. Every man is different. Some men do fine with less release, while others feel more discomfort when they stop. What matters is paying attention to your own body. If you notice pelvic pressure, more trips to the bathroom at night, or changes in sexual health, it could be your prostate signaling that it needs more activity or attention. So, to summarize this section, slowing or stopping release can lead to fluid buildup. Congestion may cause pressure, aching, or irritation. Urinary changes like weak stream or nighttime trips can increase. Circulation may slow, raising risk of inflammation or calcifications. Hormonal balance may shift, lowering energy and desire. Sleep and daily comfort often suffer as a result. These changes don't mean something is wrong with you. They mean your prostate is responding to inactivity. The good news is there are ways to support it, even if you choose not to masturbate regularly. And that's what we'll cover in the next section. Practical, safe steps to protect your prostate and maintain vitality after 50, whether or not you stay sexually active. Before we continue, if you're finding this valuable, please take a moment to like this video, subscribe to the channel, and share it with a friend. Prostate health is not something men should stay silent about, and your support helps get this message out. Now let's move into the last and perhaps most important part of this discussion, what you can actually do about it. We've already talked about how stopping masturbation might affect your prostate physically, and we've looked at the hormonal and psychological side of it. But none of this information matters if you don't know how to take action in your daily life. So in this final part, I'm going to share with you practical, down-to-earth advice that every man over 50 should follow if he wants to keep his prostate healthy, his energy up, and his life enjoyable. First things first, let's clear up one misconception. Masturbation is not the only way to support prostate health. Yes, it does play a role in flushing fluids and keeping circulation active, but lifestyle is the real king here. What you eat, how you move, how you sleep, and even how you manage stress are the big players. So don't think that if you stop masturbating, your prostate is automatically doomed. It doesn't work that way. Your body is much more resilient than you think. Number 1, nutrition. What you put in your body every single day has a direct effect on the prostate. Foods rich in antioxidants like tomatoes with their lycopene or nuts and seeds packed with zinc are excellent for prostate tissue. On the other hand, heavy processed foods, excess red meat, and too much alcohol can irritate the gland over time. If you want your prostate to stay in good shape, your plate should look more colorful with vegetables, whole grains, and lean proteins. This doesn't just protect your prostate, it also protects your heart, which is closely linked to male hormones and overall vitality. Number 2, hydration. This one often gets overlooked, but it's very important. Your prostate, like the rest of your urinary system, benefits when you drink enough water. Staying hydrated helps reduce the risk of infections and keeps your bladder working smoothly. Dehydration, on the other hand, can make urination more difficult, which puts extra strain on the prostate. So keep it simple. Aim for clear, light-colored urine most of the time. That's the easiest sign you're drinking enough. Number 3, regular checkups. This might not sound exciting, but trust me, it's life-saving. Men often avoid the doctor's office until something goes wrong, but your prostate deserves preventative care. A simple blood test for PSA levels, along with a physical exam when needed, can give you peace of mind and catch problems early. Remember, early detection is your best defense. Don't think of it as weakness, think of it as insurance for the years ahead. Number 4, movement and exercise. Gentle but regular movement does wonders for prostate and hormonal health. Walking, light strength training, or even simple stretches improve blood flow and reduce inflammation throughout the body. There's even research showing that men who exercise regularly have a lower risk of prostate problems. You don't need to run marathons, just consistent, moderate activity. And here's a little bonus. Exercise naturally boosts testosterone, which often dips after 50, and that alone will give you more drive, better mood, and less fatigue. Number 5, stress management. This one often surprises men, but your prostate is indirectly affected by your stress levels. When you're under constant stress, your body pumps out cortisol, which can suppress testosterone and create hormonal imbalances. High stress can also lead to inflammation, which nobody wants. Whether it's deep breathing, prayer, meditation, or simply taking time to enjoy a hobby, lowering stress is medicine in itself. A calm mind supports a healthier body, especially after 50. Now, let's tie this back to masturbation, since that's our central topic. If you stop masturbating and you combine that decision with a lifestyle that is sedentary, high in processed foods, and low in hydration, then yes, your prostate could face more strain over time. But if you stop and instead replace that release with exercise, healthy eating, and regular checkups, your prostate can still remain healthy. The choice is in your daily habits, not in one single action. But there's something else I want to emphasize here: mental well-being. Some men feel guilty or ashamed when it comes to the subject of masturbation, especially as they get older. Let me be very clear. There's no need for guilt either way. Masturbating is not shameful, and not masturbating is not shameful. What matters is how you feel, how your body responds, and how you take care of your health overall. Emotional peace is just as important as physical care. And here's a surprising truth you might not have expected. Your prostate health is often a mirror of your whole body health. If you keep your weight in check, keep your blood sugar steady, and keep your heart pumping strong, your prostate usually benefits right along with it. It's all connected. So let's wrap this up with some powerful takeaways you can put into practice right now. Number 1, eat for your prostate, not against it. Number 2,
Move your body every single day, even if it's just a walk. Number 3, drink more water than you think you need. Number 4, see your doctor before there's a problem, not after. And number 5, don't carry stress like it's a badge of honor. Release it. Gentlemen, the reality is this. Stopping masturbation after 50 doesn't destroy your prostate, but ignoring your overall lifestyle just might. Take these steps seriously, because they don't just protect your prostate, they protect your quality of life, your independence, and your energy for the years to come. And finally, if you found this video helpful, make sure to hit that like button, subscribe to the channel, and share it with your friends or family members who could benefit from this advice. You never know, you might just be helping someone live longer and healthier.